This is a good one. PDRN, salmon DNA, or what is commonly called salmon sperm. I don't know if I should say that one.
Welcome to Beyond Beauty, where confidence meets care. Join us as we uncover the art, science, and soul behind today's most refined cosmetic treatments.
Welcome back to Beyond Beauty. My name is Adele and I'm a consultant here at Vancouver Laser, and today we are going to discuss microneedling and Introfill. And who better to join us for this conversation than our in-house Introfill aficionado, Megan.
Hi everyone.
Thank you for joining us. So Megan, let's get straight into it.
Okay.
What is Introfill?
Introfill is my favorite treatment. It's where we customize certain ingredients and deliver it into the skin with microinjections.
Honestly, Megan uses Introfill like some people use duct tape. I would say the cure-all for everything. So for fine lines, Introfill, dull skin, Introfill, left on red, Introfill. So who would benefit from Introfill?
Anyone can actually benefit from Introfill. Anyone that is looking for hydration, glow, that has thin skin, and kind of just overall have that really good skin quality.
All right, so what does an Introfill treatment look like from start to finish? What can a patient expect?
Okay, so when you come in for treatment, we always start with photos first. After photos, we apply numbing cream. Numbing cream takes about 45 minutes to 55 minutes. We leave it on a little bit longer just because the treatment itself might feel a little bit uncomfortable, but totally tolerable. This is what an Introfill needle looks like. There are 9 little needles inside there where we inject specialized ingredients into your skin. So it does feel a little suctiony, but totally comfortable with numbing cream. If you'd like, we also give you Tylenol as well.
And so what does the recovery look like for Introfill?
So with Introfill, you might be a little bit swollen just because we are infusing those ingredients into your skin. There might be little pinpoint bruises just from the little injections from the needle, but that would probably only last about, I would say max maybe 5 days. After that, it's pretty okay. I'd like to say the peak of when you really see your skin quality kind of glow would be 2 to 3 weeks.
2 to 3 weeks. So if you had a big event coming up, say a wedding or something where you wanted to be photographed, 2 to 3 weeks beforehand would be the ideal time.
I would say if you want to plan this for an event, maybe about 4 weeks before, just to make sure that, you know, all the swelling's gone down and that none of the bruises show as well.
All right, so next question, what is microneedling?
Microneedling is different from Introfill. Microneedling is where we create microinjuries into the skin that triggers your body's healing response to promote collagen and as well as elastin.
All right, and who is microneedling for?
Microneedling can be good for everybody. I would say anyone that's starting into lasers or any sort of aesthetic treatments. It helps with fine lines and wrinkles, texture, pores, even acne marks, kind of goes for any kind of skin concern.
All right, and so for microneedling, what can a patient expect?
So for microneedling, same thing as Introfill, except our numbing is about 40 minutes. After that, the treatment itself is about 30 minutes, a little bit quicker. This is what the needle looks like.
It's a little bit smaller.
A little bit smaller, but there's actually 36 needles inside. So this goes over your skin. We do use a glide with it. The glide that we use is hyaluronic acid, but we do actually have different boosters that can amplify your results as well. So this would just go over your skin versus Introfill where it kind of stamps onto your skin.
All right, and so for downtime for microneedling, how long can a patient expect to have downtime for?
I would say you're gonna be a little bit red, maybe looks a little bit sunburnt. That should subside within 24 hours to 48 hours.
All right, Megan, so we've gone over Introfill, we've gone over microneedling. Now, if a patient is trying to decide which one to do, how should they decide?
So for microneedling, you wanna think of overall skin repair, improving the texture of your skin and promote that collagen and elastin production. As for Introfill, if you're trying to look for just improve your skin quality, hydration, and as well as a glow.
So if you're trying to look hot for an event, Introfill, and if you want more long-term results, we're looking at microneedling.
Yeah, you got it.
All right. Okay, so you touched on boosters for a second when we were talking about microneedling. Let's dive into that a little bit more.
1 second, let me go grab them.
All right, so we briefly touched on boosters when we were talking about microneedling, so let's dig into that a little deeper. Boosters, why don't we start with PRP? Can you explain what PRP is?
Yeah, so PRP is platelet-rich plasma. That's where we draw your own blood, spin it through a centrifuge, and then it separates into our own growth factors that we can apply over your skin through microneedling. It stimulates collagen as well as skin repair.
Can you use PRP with Introfill as well?
You can definitely use that with Introfill as well. Yes.
All right. Okay, so next one, let's talk about NCTF.
Okay, let me see where it is. So this is what NCTF looks like. NCTF is really good for hydration. If you're really looking for that glow in your skin, there's about 60 plus amino acids and nutrients that we inject this through Introfill.
All right, so like a juicy multivitamin.
Yeah.
Okay. This is a good one. PDRN, salmon DNA, or what is commonly called salmon sperm. I don't know if I should say that one. What does that do?
So this is my favorite booster that I would use. So Nucleoskin is PDRN, salmon DNA. It's also with glutathione and as well as hyaluronic acid. So anyone can use this. If you're looking for skin regeneration, if you're looking to reduce your fine lines and wrinkles and kind of speed up your skin repair.
So kind of that Korean glass skin look.
Yeah.
All right. Okay, exosomes.
So exosomes. So these are our exosomes. Think of skin communication where tiny little messengers tell our cells to repair and regenerate.
All right, so we went over exosomes. So what about secretome?
I think you're better at answering that question. So what are secretomes?
Okay, hot seat. So secretome is a personalized cocktail of your own exosomes, PDRN, elastin, collagen, that can help restore those natural pathways that are uniquely tailored to you. So for example, taking iron is great. Taking iron with vitamin C is better. It helps with the absorption, right? So with your secretome, it can be better because it's uniquely tailored to you and it comes from you. All right, so microneedling is great. Microneedling with boosters is better.
I would say so. I mean, anyone can still benefit from just regular microneedling just because there is the hyaluronic acid glide. But if you want to really amplify your results, I would highly suggest the boosters just because each booster kind of targets different concerns. Who wouldn't want to have really, really good skin results?
And so then I would assume by adding a booster, you're going to get more of those immediate benefits.
Yeah, exactly. I would just want to think about like anything that you're adding a plus to. You want to just really amplify and have better results.
All right, so for both microneedling and Introfill, how many treatments do you think a patient should consider doing?
So for any treatments, there's never a one and done treatment. For microneedling, you want to start off with a minimum of 3 treatments. Depending on your skin concerns, it can be a minimum of 6. You do want to space them apart at about 4 to 6 weeks apart.
Okay, and then for Introfill?
So for Introfill, again, start with a minimum of 3. You want to space this apart 4 weeks apart.
4 weeks apart. All right. Yeah, something I like to say to patients is people who do microneedling regularly have the best skin. So it's one of those treatments where if you're wanting to see a result, if you have acne scars or something that you're really working towards, you're going to want to do a series of them. But do microneedling whenever you can.
Yep.
Same with Introfill. Do it whenever you can.
You can do it whenever you can. You can do them, every month if you wanted to. Just depends if you have an event you're going to. Introfill, maybe do that 4 weeks beforehand. As a maintenance, you can also do it as well. It just depends on what treatments you're doing this with and what kind of results you're looking for.
All right, so that wraps things up. Whether you are considering microneedling or Introfill, they're both great treatments. I've tried microneedling many times myself, but I'm very excited to try Introfill.
Thank you for tuning in.
Thank you for tuning in. Thank you for tuning in to this week's Beyond Beauty, and we'll see you next time.